we go.
Like to welcome everyone to the Board of Health meeting Monday, May 13th at 6 o'clock PM. And our first agenda item, or first thing, will be our call to order. We're going to acknowledge that Michelle is absent now and perhaps for a few meetings for medical leave. Otherwise, Stephanie Granger here. Megan
Here.
and Sue
Here.
and Joanne is unable to be with us this evening as well. So we'll move forward now with open forum.
I don't see any hand raised.
Okay. So then we can move on to the approval of the minutes, which looked pretty good to me.
Yeah. Whoever's doing them is doing a good job.
Yeah, really doing a great job. So no comments on the minutes? If there's no comments.
I'll make a motion to approve.
Okay. Motion made. Is there a second?
I'll second.
Megan seconds. All in favor. Stephanie, aye. Megan?
Aye.
And Sue?
Aye.
Okay, great. All right, so we're a little early on the next thing. Maybe we should take something like the budget update out of order here.
Well, Joe's here.
Is he here? Okay. You
Yep.
don't think we're waiting for any, that we need to wait for any abutters or anything?
Abby, do we have anyone attending that you're aware of?
Not that I'm aware of. I didn't know if the septic designer though is going to attend. Maybe we could ask Joe and see.
Yep, it's up to you.
Why don't we wait just in case, since
Okay.
that's a time and a stamped
Okay.
everything one. So we can take the budget update with no override. That
Sure.
was
So
approved?
I just wanted to bring to your attention, I don't know if you saw any of the town manager's information that was put out, but the override was not passed a town meeting. So for the health department, what that means, I know we've discussed it in the past, the school dental program was slated to be eliminated. We are looking for other opportunities, funding opportunities to provide that in the future, or other resources that might be available for families here in Westford. The public health nurse and the revolving account was approved, which we're very excited about. And as far as other budget items, we were pretty fortunate as far as just consulting, membership, trainings, things of that nature. Those areas were cut. But hopefully we'll be able to supplement with some grant funding down the line. So I just didn't know if you had any questions for us as far as how that affects the department with the budget, but that's really pretty much it for us. We were pretty fortunate compared to others.
You say you were fortunate, but I want to point
Yeah,
out that's because of all the grant money you pull in.
Mhm.
I was just gonna say the same thing. I don't think people realize how many grants you bring in, and not only, I was telling friends about this, that and your grants benefit other town, not just the health department. So I don't think people realize what the health department, what you guys have done with all your grants. So thank you.
Yeah, thank you.
Thank you. No, we appreciate that. It was actually Michelle that said, "Oh my goodness, Ray, on the reel is the health department's at the top for grants." And
I
I
know.
couldn't see the reel from where I was sitting, checking people in. So I was
It's
happy for
amazing
that.
how much money you guys have brought in. So thank you.
Okay, then I guess we can go on to the shared services grant information.
Sure. So I just wanted to bring it to your attention. This grant is on the select board agenda for tomorrow evening under contracts. And so we do need their approval and the town manager's signature for this grant. This is the Public Health Shared Services Grant that funds 2 of our consultant positions. It funds our regional coordinator. Also, we have a brand new regional inspector position it covers. This year, it's covered all of our inspection equipment, our brand new software for inspectional equipment. It does help with some trainings, digitizing some records, And with admin funding, we're able to purchase AEDs for 8 different departments here in the town. So, and other various items that we've been able to purchase with this funding. So, as you can see, this is the amount for the next 3 years. Almost $2 million for the next 3 years. So that's exciting that
Can you
those.
bring that up? Can you bring it up? I mean, I'm looking.
Sure.
Here, but I mean, that's incredible amount of money.
Again, Ray, that just shows, fabulous job helping our
And-
town
And
continue.
why do you have to
health
go
department.
in front of the select board? For what reason?
Sorry, let me just bring this up.
They just have to approve it, like sign off on it.
So here is the budget. What the budget looks like. Can you see that?
Not yet.
Yeah,
Oh, yeah.
Okay.
No, I'm looking at are you talking about the DPH master agreement engagement form?
yes.
Yes.
So that's actually over $2 million.
It is. So what happens is, you can see here from the top, it will cover these 2 program staff positions.
Okay.
And that includes everything with their position. So I get a question a lot about, mileage, their benefits, will that affect the town? This covers everything for these 2 positions, including all their equipment, mileage, whatever they
Okay.
need in their benefit package.
Okay.
These are
Yeah.
some of the other items, and this is the admin money that goes back to town.
Jesus. But we're talking over 2 million. So where does the other money go?
That's annual, like each,
This is each year is what we'll receive, this amount of money.
Oh, okay.
Yep,
And it's for how many years? It's for 3 years?
for 3.
Okay. Okay. Gotcha. Okay. There's still extra money, but wow. Okay. Yeah.
Yep,
Incredible.
so, roughly a little over 80,000 will go back to free cash for the community. So we do work with the town manager's office to utilize some of that funding too for program for the health department and other departments to help them out.
And who writes all these grants, Ray?
I do. We have a grant manager that helps us with the budget, and we attend lots and lots of meetings every month for it. But this is one of many grants. So
I know. Incredible.
so yeah, it's quite busy, but yeah, we're fortunate to have it. So
thank you.
sure.
It's really, really makes a big difference.
And to answer your question, Sue, so any contract that the health department receives, whether that's with our MRC coordinator, with many contracts, all contracts have to be signed by the town manager, which have to go through the select board. So,
Okay.
yeah, so I'll be on tomorrow night.
Assume they'd be very grateful.
Okay, so let's leave the discussion on the cannabinoids. And can you tell us about the community health assessment completion?
Sure. So this has been a long time in the works. BME Strategies is our consultant who helps it used to be called an accreditation coordinator. It's now called quality improvement coordinator per DPH. And so they've really worked really hard to help us with our community health assessment. We put together a partnership of stakeholders here in the community, including faith-based organizations, mental health folks here and businesses here in town, several departments. I'm trying to think of some of the other folks besides departments. Oh, and some local organizations. For instance, one example is the DEI committee sits on our stakeholder. So we have a little bit over 40 stakeholder vendors who attend our meetings or are remote, and they have also chimed in with opinions throughout this whole process. We've met over 5 times on just the community health assessment portion, and as you can see in your packet, that is the final draft of the community health assessment. The first 4 under executive summary, I believe it's page 2, is the priorities that came out of all of the survey information, which is substance use, mental health, environmental health, and chronic disease. So those were the biggest concerns from the Westford residents. And as you can see through some of the data in the assessment, that's what our improvement plan will be based on. So the partnerships are still meeting. to talk about what kind of programming and strategic planning we can put together moving forward. So that's stage 2. And then the final stage will be the strategic plan for 5 years out. So this does also help our accreditation process. But as you can see, this is the first assessment.
But you'll be
We
able to
wanted you
use
to see
that.
it. I'm
before
sorry, we
the-
wanted you to see it before we put it out to the public or shared it with other groups and departments.
How many years have you been working on this?
Um, it's been a little bit over a year.
God, this is so comprehensive.
We weren't able to, a lot of people will ask, as you know, we tried to put in for ARPA funding for the community health assessment when the ARPA funding first came out. Unfortunately, that wasn't able to be approved at the time through the town. So we have utilized our consultants to help put this version together. And the reason I mentioned is a lot of people say, well, how come you didn't survey the community? We did survey the community, but not by household. So we pulled all the existing data that's existing for our area, our region, and for Westford through stakeholders.
It's interesting with your statistics because it's right online with, when you look at the survey, 21% mental health issues. That's right par for what we see. That's what the reporting is, 20% of people. So interesting.
And it's always good to have the data, right? To back
Yeah.
up resources that we need and to make sure that we're providing programming. And when folks ask about signs on the common or changing stigmas, or, it's nice to have the data to say, well, this is, what the residents are looking for. So.
And what's going to happen with this information?
So this information we'll share out with all the departments. It will also, we're going to utilize it in our accreditation process. And then what it does is it helps us put together what's called the community improvement plan. So that's when we look at all this data and we work as a group, as a partnership with all the stakeholders to say, okay, this is what the community wants. Now, what are we going to do? How are we going to plan that out? What's our timeline, our strategic plan on in implementation for what does that mean with the schools, resources that they need, things like that.
Interesting. And really fascinating stats. Who put this document together?
So this was BME Strategies, and they're the consultant, like I said, that we use for our coordinator and our shared services.
Okay, it looks great.
And they do have quite a bit of a background in community health assessment.
That's awesome.
Yeah, the whole staff was a part of the project, and yeah, it was really great to get, feedback from recreation and our community wellness coordinator. And like I said, a lot of partners here in the community.
So ideally then, as we move forward in things, we'll be trying to target to these areas of concern.
Yeah, climate change came up. A lot of items came up. Abby, I don't know if you remember, but at the time it was about 10 different items. These were the top 4. So, and then also looking at the top 10 concerns, what could we possibly manage with the capacity that we have? Not just for our own department, but as a group, for our stakeholders who can invest time, whether you're a volunteer or your staff with the town, that kind of thing. So.
Well, it certainly justifies all the additional staffing that have been brought in, when you think about it. So it's awesome. Really good.
Yeah.
I downloaded on my iPad.
Don't like the statistics there.
Yeah, and the hope is too that, this data will help other groups here and other organizations, whether it's recreation, that's looking at putting in some kind of facility in the future, or the town managers working on a strategic plan for the community. And hopefully some of this data will be helpful again, but you're first to see it. So, yeah, hopefully, it will help others down the line.
Great. Thank you.
It's really, really good. Thank you.
Okay, if there's no more comment on that, then we can go back to our 6:15 agenda item, the local regulation variance and Title V local upgrade approval request for 18 Lawson Road.
All right, I think Abby's gonna handle this one. Abby, is Seth Donahue also?
He's here.
Okay, so let me, promote both of them.
If-
Okay,
I'll see.
hi, Joe, hi, Seth.
If possible, if you would turn on your cameras, that would be great. Thank you.
And Abby, I don't know if you want to give a little overview of the variance request tonight.
Yep,
Oh, go ahead.
I-
Sorry, Abby.
oh, yeah, just a quick overview. I mean, you'll get more in depth with it, but I think most of you board members have, experienced one of the Damnasset small lots in the past. This is the side that has private wells and of course septic systems. So tonight we're looking at some variances with wells and septics, and there's 2 abutters that are affected. It's pretty much it.
And that none of them are present. They all acknowledged through.
If the board would like, I'd be happy to go into some detail of what we're here for you.
Sure, that would be great. Thank you.
Okay, great. So my name is Seth Donahoe. I'm with Dillis and Roy Civil Design Group. With me tonight is Joe Crory as well. Joe is the owner of 18 Lawson Road. Joe is actually a septic installer, and I'm sure the board has worked with him in the past. He does a very nice job. This is a project that Joe, I think, has reluctantly taken on. He needs to replace the system at his existing house. And as you mentioned, it is a rather small lot, 0.2 acres, and it's right against Nabnasset. Would the board like me to share my screen so you can see an image of the plan?
That would be great.
Great, I'll bring that up. Oh, I'm disabled from screen sharing. Sorry, Ray.
I think it was in our packet.
Yeah, could we pull it up, Ray? If not, the
Yeah,
plan?
we can. Yep, I just made him. Yep, but I can also bring it up.
Oh, it's coming up now. If we
Okay.
had a bandwidth lag, perhaps. So
There's a little
Oh.
delay.
hopefully what's before you now on your screen is a zoom in of the design plan that was submitted to the board. And as I mentioned, this is 18 Lawson. Nabnasset is at the rear of the lot. Lawson Road actually encroaches onto the lot a little bit, and the proposed septic is right in this general area here. And what we're here before you tonight is that we are impacted by 2 wells primarily. The applicant's own well, number 18, which is existing. And then we also have a well at number 16. And in accordance with your local regulations as well, we also need relief from the local regulations due to the well at number 22 being within 100 feet of our septic tank and pump chamber. So leach field in itself is only impacted by the existing well and the abutter well to the west of the property. Fairly constrained with where this system could go. As you can see, we have it 10 feet off the lot line. There is a gas line that's existing. So we wedged the system in there to keep it out of the 100-foot buffer zone. And that does clip 2 of the well radiuses for the leach field itself. So we've given you details on the exact distances. The closest affected property is the locus itself, number 18. We are 53 feet from the well to our own septic tank. And then the leach field is 78 feet to the well on number 22 and 80 feet to the well on number 18. In short, there's nowhere on the property that we could position it to avoid these variance requests. We're pinned in the corner and at the maximum extent feasible, getting it away from the well itself. And the applicant has elected to use a pressure distribution system to eliminate a D-box as well. So that'll essentially provide the benefits of distribution through the leach field and also prevent the deterioration of the D-box years down the road as well. So that's why we're here in a nutshell. If the board has any specific questions for me, I'd be happy to address them.
Sue or Megan, do you have any questions?
No, I wanted to know how, what Abby and Ray think about this plan. They comfortable with the plan?
Yep, I reviewed the plan. We had an initial round of comments and now I'm comfortable with the plan. I believe if you remember, 2 meetings ago, we had our local septic regulations on and, effective May 1st, the Westford, local regulations have dropped the 50-foot requirement from well to a tank. So obviously we're comfortable with that. More the concern is the leach field, but I think, he's done his best to get them as far away from the wells as possible with this lot. And, it's far away from the property owner's well and Nebnasset Lake. I did inquire about secondary treatment, if that would be an option, but I believe, it was deemed too costly. Seth, I know we discussed that. I think we are pretty far as we can be from the well, so I'm comfortable with the plan.
And you let the abutters know and nobody seemed to have concerns about it. Yes.
Correct. So they were notified via certified mail and we provided the health department with copies of the return receipts for those.
Yep.
Okay.
It looks like, I mean, generally in that area, that's kind of,
Par for the course. Yeah.
I
Yeah.
think it's,
Tight.
it's
It's
part of the
tight.
neighborhood.
Yeah, everyone has yeah.
And there's no town water out there, so it's
Right.
tight.
Well,
Okay.
how do we approve this? Do we have to go through them one by one? Ray?
Yes.
Or do-
Yeah.
Okay. Okay. Well, so 3 different regulations then?
yeah, it looks
3
like
different,
3
right?
different motions.
3 different motions. Okay, so I'll make a motion for the reductions, a 310 CMR 15.405 1G, reduction of the required 100-foot setback of a leach area from a private water supply well.
I'll second that. All in favor, Stephanie, I, Sue,
Aye.
Megan.
Aye.
Okay, that passes unanimously. Well, I don't, are we unanimous if we're 3? I guess, okay.
You are.
All right. Do you want to keep going, Sue, or?
Sure, okay, and then the second part of this is 310 CMR 15.405 1K, reduction of the required number of deep test holes. That's the request.
I'll second that. All in favor, Stephanie, I, Sue,
Aye.
Megan,
Aye.
that passes unanimously again.
Okay, and then the third part, make a motion for the regulation 6.4. The minimum distance from a septic tank, pump chamber, or soil absorption system to a private drinking water well shall be 100 feet. Is that right?
Yeah,
There's so many different things in there. That's what all we need to do to make the motion. Yes?
yeah, I think
Okay.
so.
Yeah.
I'll second.
Motion made and seconded, no further discussion. Then we'll call for a vote. Stephanie, I, Sue,
Aye.
Megan.
Aye.
Okay, that passes unanimously. Thank you.
Thank you. Have a pleasant evening.
You
Thank
too.
you.
Good luck.
Good
Good
night.
luck.
Bye-bye.
Okay. Then we can move on to our discussion on a proposed regulation for prohibiting the manufacture, sale, and distribution of synthetically derived cannabinoids. Sorry if I'm always looking this way. I have a nice big screen next to me with all the documents on it. So I'm looking over here to see things nice and big.
Sure, so let me just bring that up for you. If you can see this is quite.
Got a nice technical document here.
Oh, yeah.
So these were some of the items in your packet. These were the written statements that Cheryl Sabara, the DPH MAHB attorney who was at the last meeting promised. This was the sharing document. Let me just bring up the actual model regulation here. There we go. Just takes got a little delay here on our end. Can you see that?
Yep.
Yeah.
So as you can see, it's not too long. Pretty much just has an enforcement piece, penalty, the glossary, and it goes on to just say that they, can't be manufactured or stored or sold here in Westford. I would say for myself, my only concerns is going to be, it's on page 3 at the top under number 2 when it talks about the responsibility of establishments when you get into the penalties.
Yeah.
Um, you can see that the fines are quite high for first violation. And so we may want to just talk about that. And then, like I said, in number 3 here, it's 2-3. In the case of 3 or more violations within a 36-month period, a fine of $5,000, so just trying to keep track of some of these places without the capacity,
Yeah.
it just makes us a little concerned with that section.
Yeah, I guess,
Just
how many
talking out
places are
loud.
these being sold that differ from where we're checking on tobacco?
I don't know. When our food inspector goes in to do food inspections, they're not always looking for, or convenience stores, if they have pre-packed foods, when they don't even have a food permit. If they're selling any dairy or anything that has to be refrigerated, they do have a food permit. So again, they're focusing on their food inspection, not necessarily CBD or gummies or, there's so many different energy drinks, it would take a few minutes to go through them all and see exactly what some of those ingredients are. Now, with our new regional inspector, speaking with her, she is willing to go out and check on these items. But again, at this point, we don't know how many are out there.
Well, I think, also given what some of the findings were and the desired focus of the community, this is in line with the top priority. The 4 top, whatever items being substance abuse. So I think it is important to try and.
So are we talking about adopting this regulate or, making a new regulation?
We would add this to the tobacco, or is it a new regulation?
So it'd be a new regulation.
Okay.
And I know you had all asked to see the model regulation that the Massachusetts Association of Health Boards created, and this is it. So this is their model for all, any health department that would like to adopt it. So you can see right now it's in draft form. We can certainly bring it back to you for the next meeting. Again, in draft form, but with Westford letterhead on it, and certainly, we can bring any concerns we have to you.
Do
Or
you know how many communities around us, or with the shared grant, are any of the towns around us, do they have this regulation?
They do not. So it's less than 10 in the state, and it's due to, as Cheryl had mentioned, because of capacity, folks having the manpower to also
Enforce,
inspect for
yeah.
this. But I would say that, I did reach out to our shared services communities, and this is certainly something they too are also interested taking on as a group.
Okay.
But at this time, the regional inspector was just hired last week. She has lots of experience, and certainly she could go out and, provide education and things like that, and also do it, but we have to make an inspection form, things that are attached to this regulation. The other communities expressed interest, but I will say Acton is a brand new director, so she wanted a little time first. Lowell didn't have the bandwidth right now to take this on, so it would just be Westford at this point.
In terms of the fines, you were concerned that they're pretty high. I guess I'm curious where they selected these numbers from. They're higher than tobacco fines, or are they the same as the tobacco violation?
The first 2 are the same as tobacco. The third is much higher. If a retail store is caught selling, for instance, to minors, it's $1,000 fine for first offense. It 3,000 is the top.
So I'd be curious why they,
Yeah, and I
Yeah.
can certainly ask her why these particular amounts were chosen.
I mean, I think it's a
maybe-
good thing to be looking into, but I think we shouldn't be trying to do this anytime
right.
soon. Like, I think,
So for a regulation, do we have to hold a,
You do. So if you go down to number 7, you can see that upon accrual of 4 violations, again, we'd have to have someone that's keeping track of that.
yep,
I think, like I said, and then it talks about, a hearing, in front of the board. A suggestion, speaking with staff is that we could, bring this back for next month, but maybe start with an educational campaign. We can bring you a proposed regulation, again, after talking to town council. I want to make sure that, these fines are okay, especially where we have a fine system that's already been voted on for the town of Westford for first, second, and third violation. We generally try to give someone a chance to, with food and other permits, give them an opportunity to correct. With tobacco, there's no correction. You're fined right on the spot. But again, those are only suggestions to have an opportunity, I think, to read through it all. That's up to you.
I wonder, like, even with which towns have adopted it, maybe get information from them,
Sure. Yep.
They
I
may
can
be able
certainly
to
do
provide-
that.
Yeah,
I'll reach out to Cheryl and see
Yeah.
not only why they picked those numbers for the fines, but what communities have adopted it and how is, check in with them and see how that's going.
And what's the actual process once if we were to approve it, how, like, moving forward, what is the next step?
So the next step would be, you would make any suggestions that you wanted to see. We would bring you back a proposed regulation with
Right.
all the changes on your end and our end. And then what you could do is, if you've all voted to enact this, you could set a date in which you'd like to see that this regulation enacted. Again, we would need to make sure we put in enough time for creating an inspection report. Yeah, that's pretty much and then we go ahead.
so can we ask then to run it by legal and see what their thoughts are?
Sure.
And then if we discuss it next week, next month rather, we would have that perspective. Along with maybe Cheryl's thoughts on the fine structure and if there are any other towns with experience, what theirs has been thus far.
Sure, absolutely.
I do think your idea of the education piece though
Yeah.
was good, because when she was sharing, it did sound like there was lots of confusion over what was actually being sold and what was being, the FDA was following versus, food versus not,
Yeah. Yeah, no,
all
I agree.
Christie's.
Yeah.
So,
Well, we're confused too. So if like we're
there you-
confused,
yeah.
yeah. So no, but I agree with you. If so I think educating people about some of these products is not a bad idea, especially since I could use some education too.
Yeah, and we, and another idea is we could certainly work with get the answers to all these questions and work with the new inspector and see, after maybe she goes out, takes a peek, see what's out there, educate everyone, and maybe report back to say, yeah, it's a real problem, we need a regulation, or maybe it's not an issue, I don't know. Again, we're not really looking for these products, so we'd have to do a little investigation, if you will, and then educate.
Yeah, I mean, I guess whether or not it's currently a problem that can change so quickly, but I think it wouldn't be bad to have an idea. And clearly, definitely, it sounds like, you know, even if we do decide to enact this, we can put a date far enough out that we can do some education beforehand.
Absolutely.
And yeah. Okay. Any other comments or thoughts or questions on that? No? Okay, thanks, Ray. It's really an interesting, constantly new things.
Oh, absolutely.
Okay, so then I think we are on to new business.
Yes, so Arlene Almato Soto is a new regional health inspector. She did just start last Monday. She is going to be in Westford on Mondays, and then she'll be in each community. You know, for instance, Acton on Tuesdays, Drake at the yada yada, Lowell. And we will swear her in for the June meeting, and she'll be on the meeting to introduce herself, and she's looking forward to meeting you all, and she's very enthusiastic and excited to get started.
Great.
Health Department's record supervisor position is posted. Come Friday, I believe we'll be past the 10-day requirement for internal posting. So we have received some candidates that we're excited about. So we'll start that interview process. And in your packets, I just wanted to make you aware of correspondence for support letter for the community project funding through Congressman Lori Tahan's office. And that was through the assistant town manager's office here that was looking for some support, additional letters for PFAS funding, assistance here for public water suppliers. And so we reached out to our Healthy Lakes and Ponds organizations. They all put up letters, and the health department, it was a quick turnaround. So the health department did put in a support letter for that. And the next item is the discernment request for Westford residents. So anytime that application is filed with the Board of Health, that needs to make sure it goes in front of your eyes. So as far as this is a resident who is looking to have a body exhumed from the Pine Street Cemetery here in Pine Grove Cemetery here in Westford, to be transported to a Carlisle final location. So they have to fill out a form, have the health department review birth certificate, death certificate, location, and we work with our cemetery department to make sure that everything is followed by Mass General Law, and they do also sign off on transport. So we're working with the
Nice.
Blake's funeral home to do that in Chelmsford.
Wow. There's so many things that you guys do.
You just something new every day, right?
Yeah, jeez, yeah, wow.
On today's episode, no,
Mm.
yeah,
Yeah, truly, wow. Never saw that one come.
Keeps it interesting.
Yeah.
it does. AEDs. So I mentioned this earlier. We just wanted to make sure that you are aware that we're in the process. We've already purchased some for police department and a few other departments. We do have some coming in for school fields and recreation, IT, and several other departments for AEDs and stop the bleed kits for their
Great.
departments. New Sharps disposal kiosk. So we just purchased one here at the police station for any resident that may be listening that has Sharps, whether it's for their pet or for themselves or a family member. We do take those here at the health department. You can put those in a puncture-proof container, and there is a kiosk right now over at the police station that needs to be updated. So we have purchased a new one, and that's coming in. But we also take them here at the health department Monday through Friday, 8 to 4.
If somebody just goes up to the desk and,
Yep, they can put it in a laundry bottle or Coca-Cola bottle or.
Wow, that's good to know. Yeah.
Yeah, so we take those here, and then if it's after hours, the kiosk is 24 hours over at the police station, right in their vestibule. Massachusetts Recreation for Camps, so the camp regulations that we enforce at the health department, those have recently been updated. And so Abby, Sam, and our public health nurse, Gail, all worked together collaboratively and put on a presentation to our camp directors here in the town, which I think they really appreciate, because we provide that every year with, especially when there's a year, there's updates by the state, and it keeps them current and they're able to ask questions and builds that rapport. So a big thank you to Abby, Gail, and Sam. All right, and digitizing records. So we do have some funding through grants to start digitizing some of our records here. Here, our stockpile is a big hot mess downstairs. So it's many, many years of old files that we have to keep. Some files, believe it or not, you have to keep forever. And some it can be difficult to keep track. Some are 4 years, some are 7, some are 1, depending on what kind of permit or inspection report. So we are in the process of taking baby steps to digitize some of the older records with that funding. So just wanted to make you aware of that.
That's great.
That's great.
We wanted to.
Digitize them, are you able to eliminate the paper record, or do you have to keep?
We
that?
are. Yeah, so the one that we're, like I said, for it's I'm having a blank, but Massachusetts has a whole list just alone for the Board of Health of all the different permits and reports and things. I think we're over 37 different permits that we issue, and each one has a different amount of time that you have to keep that paper information. So we're trying to get into a rhythm and a routine of pushing that information, like I said, out or tossing it and being able to scan it in and make sure that it's secure moving forward electronically. And what's nice is it's offers great customer service, because then it's, viewable and transparent to the public.
Right, yeah, that's great.
So the next thing is we wanted to thank Andrea McKinley. She's our dental hygienist. And this year she did it all by herself. Usually she has a partner. But she provides the cleanings and screenings for all of the kids here up to 6th grade here in Westford schools. And so she has been fantastic. And I just wanted to thank her publicly for all of her hard work. And she does it because she's passionate about it. And she does it for much less than what she makes, being a hygienist. So we appreciate it. So older adult brochure. So we have Sarah Pizzette finishes on Wednesday. She's a capstone student at WA, and she's been fantastic from day one. We've taken her out in the field. Abby and Sam have been great showing her things. Brittany, but she did put together a couple different brochures, and her first one was the older adult brochure for our senior dental program. She updated. We've had a health department brochure that was about 20 years old with services we didn't even know we used to provide. So she's updated that for us as well. So we want to thank her for her time here and all her hard work. The last is the mental health awareness poster contest. We tried to come up with an idea this year, working with our community wellness coordinator and with the schools. Last year, as you know, we put on a program out in the common. We did also have the proclamation approved by the select board, so we appreciate that. We have lots of events, and so that went out on social media, and that also went in your packet, all the different events for this month for Mental Health Awareness Month. But we're really excited about the kids contest. It's 5th through 8th graders, I believe. And so they have an opportunity to apply for the poster contest. The prize is Apple iPods. So yeah, we're excited about that, working with the schools, the art teachers, to get their feedback and also get them talking and excited about talking about your health, self-care, and mental health.
Have you guys gotten any posters yet?
We have not, the schools are collecting them.
Oh, I see, okay.
Yeah, the schools are collecting. We do have a couple of sites for, if you don't attend Westford Public Schools, your homeschool student or private school.
Great.
And that's it for new business on our end.
That's a lot. Thank you.
That is a lot.
I know, it's, a month goes by and a lot happens, so. Sorry.
That's great. And yes, lots of thank yous in there. So that's terrific. Okay, then we have old business. And maybe before you get started, one of the things made me think, the PFAS test results. Can you speak to, have you been receiving those and have any been of concern or?
Yeah, so we have received 47 of the 50
Oh, great.
results that have come in. We have a deadline. We have about a week and a couple days left for our deadline for the project. I know Sam and Abby have been working on, and feel free to jump in, Abby, have been working on 4 different letters. So we have, we received your results and, everything looks good. Thank you so much for participating in the project. If you have any questions, no PFAS was found. But then we have these other letters because the EPA just came out with a brand new standard for PFAS. There's the state limit, there's the federal limit. And so, 2 weeks ago, you might have not hit that limit, but now with the new EPA, yep, you do for PFAS. So, working through those hiccups and, like I said, putting those 4 different letters to make sure we have remediation packets out to all of the residents that have questions regarding, well, I hit the state limit, I hit the federal limit, what does this mean for me and what do I need to do for my well?
Is there a way for residents to see what's happened with wells in their area that were part of this testing?
So we have had residents reach out and have already asked. We have not put that data out publicly yet, and it's until the project is complete and it's been presented to both this board and the select board. We have not made it public yet, only
Okay.
to the families that have participated. But that will be visible at a point. And like I said, we're working with our GIS coordinator and the water department to get that up. So again, it will be all transparent and public, but we're still getting, we have three homes left that we're waiting for their information. Like I said, we do have a deadline about a week from now to get those letters out and to complete the project.
Great, thank you.
Mhm.
Now I'll let you go on with the other old business.
No, that's okay. Also in your packet was a letter that you had spoken about, I believe at the last meeting, that you wanted to send to the planning board and the chair regarding the draft zoning bylaw amendment. So I know Stephanie had put that together for you. And so I just wanted to make sure that other members in the public were able to see that letter. So if you have any questions, let us know. I know they were meeting on May 6th. They did get the planning board met on May 6th. They were taking in more comments during public comment periods. They did get all your information, and so I'm waiting to see at the next meeting if they do make any changes based on requests. So I'll certainly keep you in the loop on that.
Thank you.
We talked about Sarah, our capstones, and the last thing is the Buried in Treasures, the BIT program just completed. That was a program put on by Brittany Nash, Nicole Laviette, and Gail, our public health nurse. And so that's a 16-week program to help folks that have clutter. We don't call it hoarding, we call it clutter. And so this is a program, a nationally acclaimed program that helps folks deal with their clutter and how they slowly clean out areas. They had 11 participants and it went very, very well. And actually they're looking for part 2 or a support group. A lot of communities put support groups together, Facebook private groups, different things so they can stay in connection and someone can hold them accountable. They're afraid that they're gonna revert back to some of their older ways. So they've made some great progress. And it really went well. This is the first time that we've put it on. Several other communities, Acton, Chelmsford, Methuen. There's about 54 different communities here in Massachusetts that provide this through the health department.
That's great.
Awesome.
All
And
right. Does anybody have anything else that? No, then seeing nothing further, we can say thanks to Ray and Abby once again for all the amazing work you are doing for the town. We really appreciate it. And I'll make a motion to adjourn. Is there a second?
I'll second.
Motion made and seconded. All in favor, Stephanie, I, Megan, sorry,
Hi.
and Sue.
Aye.
All right, well, thanks everyone, and we'll see you.
Good night, everybody.
thank
Take
you.
care.
Thank
Okay.
you.